Good morning. Welcome to Advocacy Day 2021. This year, the Virginia Senate is meeting at the Science Museum, and the House is working virtually from their homes. And the 2021 session is a 30-day session, so we're having our first ever virtual Advocacy Day. We have a full schedule and we have a big crowd today. So let's get started with a few housekeeping tips. If you could, please funnel all questions to the chat feature. After each presenter, we will have a Q&A session, and there is a chat feature in Zoom. And so if you could funnel the comments there or your questions there, we'll try to get to those as soon as possible. If you're following on YouTube, there is a comment section. So you're going to click on the chat icon, type in your question, and click enter. Please keep your comments respectful. And also, we've dedicated time throughout the day to address questions. However, due to the large number of people attending today, we may not be able to answer every question. And I did want to mention that if you're joining us from YouTube live, then you'll be about 20 seconds behind. So we may not see your question right away, but we will try to get to it as quickly as we can. The times on the agenda that was sent to you in your packet may vary. So if we're running a little ahead or a little behind and you need to step away, please keep that in mind. But the rally will be recorded. So if you do need to step away for a few minutes, you can go back and take a look at the information from the recording. So I'm Kathy Harkey. I'm Executive Director of NAMI Virginia. And in addition to our presenters today, we have Sarah Wilson, Associate Director of NAMI Virginia with us, and Bruce Cruiser, Executive Director of Mental Health America Virginia. So Bruce is going to take it away right now and give you some background information for Advocacy Day. Bruce?
Yeah, thank you, Kathy. I'm glad to be with everyone today. Advocacy Day has been around for a while. We've been doing this for several years. And you see the winter scene of the Capitol. Well, that's not happening this year. We have to do it a little differently. But advocacy for mental health is important and effective. Next slide. You know, we say that there's no health without mental health because ultimately, the more we can incorporate the idea that mental health is simply part of everyone's health, then the more support we'll have when we advocate for mental health. Next. And Virginia has a history going back, 100 years practically, of depending too much on state hospitals and underfunding community mental health services and support. Next. And some of these slides are from the Department of Behavioral Health. And this one shows the overcrowding in the state hospitals today, which has been made even worse by COVID and the restrictions because of the pandemic. Next. Mental Health America nationally does an annual ranking of the states on mental health. It puts Virginia 39th among all the states in access to care for youth and adults, and 41st in access to a trained mental health workforce. This is not a place that Virginia wants to be. And so advocacy helps move us to where we're much higher on this ranking. Next. The Kaiser Family Foundation does surveys, and their survey, even back when the pandemic was first starting, showed that it's beginning to carry with it what we call a category 4 mental health crisis. More than half of Americans now report that it has affected their mental health. The pandemic's impact on mental health and the demand on services is expected to keep growing, as you can see from this slide, and the impacts it's beginning to have. Thanks to advocacy over the last several years, state policymakers have made mental health more of a priority with increased funding and more strategic planning for improving our entire mental health system. And the goal really ultimately is a fully funded, person-centered continuum of care in the community to decrease the need for hospitalization. STEP Virginia is the multi-year plan to ensure that our local community services boards are equipped to provide effective services to anyone, regardless of their zip code or ability to pay, and improving access to quality services for those insured by Medicaid is another long-term strategy to improve the mental health of all Virginians. And so it kind of sets up our next section here, and we're really fortunate to have the expert on Medicaid transformation in Virginia with us today, Dr. Alyssa Ward, who's the Behavioral Health Clinical Director for the Virginia Department of Medical Assistance Services. Dr. Ward is a licensed clinical psychologist, and she currently serves as the lead in the most expansive redesign of behavioral health services in Virginia, transforming the future of our behavioral health system. And with these proposed changes, the state will really start to move from a system that is crisis-driven to one that is prevention-focused and better staffed to serve Virginia citizens. So with that, that is our pleasure to have with us Dr. Alyssa Ward.
Thank you so much, Bruce, for that very kind introduction. I am so humbled to be here today and to be speaking with you all. And I'm just going to pull up my slides now so that you can see. So I'm here to talk a bit about our behavioral health enhancement initiative through Medicaid. But I thought I would start off by just telling you a little bit about me and what brings me to this work. Now I have to see how to move my slides. I think that worked. If it worked, you can see a picture of a very little version of me. So this is me when I was about 2 years old. And at this time in my life, I myself was a Medicaid member. And also at this time in my life, my father was going into the early stages of his recovery from substance use disorder. And, you know, I look at this picture today, and it's so hard to imagine the life that was to come after this, and that I would be sitting here in the position that I am now, really trying to drive change for the services for other little kids who look just like me right there. And for people who are working towards their recovery in many different ways. And I wanted to share a little bit about this today because I want those of you listening to know that lived experience and the voice of people with lived experience is something that is very important to me personally and very important to us at Medicaid as we think about how we create services that are consumer driven and that are really reflecting the needs of the people that bring us into this work to serve. And that is really at the heart of what drives behavioral health enhancement. And it is because of the incredible advocacy and hard work and support of the advocates that we've gotten to where we are at this point in moving this initiative forward. So we're just so grateful for all of that support. And I'm going to share a little bit about what that looks like today. So we have some really high level goals with working towards enhancement of the Medicaid benefit for behavioral health services. Many of you may be familiar with our ARTS benefit, our Addiction and Recovery Treatment Services benefit that went into effect a few years ago. Behavioral health enhancement really has a lot of the same goals, but expanding and bringing more services into our mental health side of the benefit to really mirror what happened in ARTS when we really opened that up and improved access and all the different types of services available to folks who were working towards recovery of substance use disorder. So one of the primary goals is really to deliver high quality care. Just like Bruce mentioned with Step Virginia, we want to assure that no matter where you live and who you are in Virginia, that you have access to high quality services, whether you're insured through a Medicaid plan or through a commercial plan. You should have equivalently high quality care. And we want to assure that we bring the state of the art treatments, things that have been shown to work for people, into our benefit, and that we pay for them in an appropriate way, because there's an expense associated with using evidence-based treatments, and assuring that teams are paid equivalent to the type of effort and materials and training that goes into these new state-of-the-art treatments. We also seek to be trauma informed. So we want to bring in treatments that are going to be sensitive to people who have experienced trauma in their backgrounds, but we're mindful about the secondary trauma that is experienced by people who are in this work. Like me as a psychologist, being in the room and sharing in the pain of the world has its own expense. And so how do we create a system that also cares for those who are doing the caring? How do we help the helpers in this process? And then, of course, we want to be good stewards of the public money that is entrusted to us at Medicaid. And so we want to make sure that the treatments are cost effective, and that we're just really using the money that is given to us towards the best possible end. This process of starting enhancement really began with the engagement of stakeholders. If you hear some kids in the background, that's just my reality right now. I can hear them. I don't know if you all can. That is where we first reached out to the advocates and began the process of really understanding what was needed, what were the highlights and the good points about what's going on in our system, and where can we improve. And there was significant effort, around a year's worth of effort in development of those relationships, that we worked together in designing a continuum of care and making a proposal for kind of what the big picture would look like. What is the North Star? We're also aware that in getting to that North Star, there's going to need to be a pretty big expansion of our workforce. Virginia ranks 41st in the country in terms of its availability of licensed mental health professionals. And so that's going to be a long-term journey that we're on in terms of understanding the drivers for our lack of workforce and how we attract them and sustain them in the workforce to do this important work. And then kind of at the top of this is developing outcomes that are meaningful to the people who participate in services, and then assuring that we have transparency around those outcomes as we begin to manifest them. And so we can share that good news of hopefully things working, or know that they aren't working and that we need to continue to enhance and redesign to make sure that we get those outcomes. This is a picture of what our current Medicaid benefit looks like for mental health, and it includes this really large purple bar that you see that represents our community mental health and rehabilitation services. These are very, very intensive services, and you can see that there's very small steps in between. And so what this creates, if we think about this as kind of like a stair step, is we spend, as Bruce said, a lot of effort in that dark purple line of inpatient hospitalization for our teenagers, residential treatment that we pay for in Medicaid, and therapeutic group homes. So we have an over-reliance on these very intensive services, and then a very high reliance on our community mental health and rehab services. And it's very hard to step down through them into recovery when the step is so large. It's kind of like a cliff that one could fall off of. So our goal is really to develop a more equitable stair step. This is a visual of what our kind of dream or North Star would be in terms of a distribution of different treatment levels, which would allow people to move more seamlessly and kind of step up and down as they go through different periods of their recovery, and engage with different levels of intensity of service as is appropriate for their preference at the time, what fits with their life, and what they need for, where they're at at that time. So this is really a high level picture. This is not what we are moving forward with immediately, because this would be a huge transformation. Going from that purple to this blue will take tremendous effort that includes everyone in the system together. But we knew that we needed to have this North Star to move towards. And so we really wanted to focus on the Commonwealth's priorities and work with some of the great momentum that has come before us. So behavioral health enhancement isn't out of the blue. It's really a development that came from all of these other excellent initiatives that really came before it and got the ball rolling. Those include, like I mentioned, our arts program at DMAS, but it includes a major transformation in the Department of Juvenile Justice, which brought evidence-based treatments in and really allowed them to close down a couple of their facilities and move towards more prevention orientation. It connects to the Family First Prevention Services Act implementation, which is just now kind of getting wheels, and their efforts to bring in 4E funds, which would pay for evidence-based services. STEP Virginia, I'm going to talk a little bit more about that one as a really important foundational piece. And then some other great work in the DOE doing this, as well as DBHDS's efforts towards implementation of high fidelity wraparound through a SAMHSA grant. So there's been all this other great work, and we're really, I call it like the big hug around all of these other efforts. Medicaid provides a level of financial sustainability by developing rates for these services and making sure that they're available throughout the whole system and not just in little niches. So in terms of STEP Virginia lays this foundation within the CSB system to say, you know, this is a standard of quality of care and a spectrum of care that the CSBs expect to be delivering to assure, like Bruce said, that there's equity within people's access to those services. Where we see enhancement as building off of that initial groundwork. So only about 20% of Medicaid members are served in their mental health and substance use needs through the CSB system. The rest are served through the private system. And so we want to bring all of the good work going into STEP Virginia into that other large community of providers to assure that we kind of bring those efforts outward and that we bring them to all of our members. Again, behavioral enhancement is really this big triangle, but we have a certain set of priorities that are lined up with the current issues that we face as a Commonwealth, and primary one of those being our over-reliance on hospitalization. And so we developed, in coordination with our partners at DBHDS, a vision for the development of 6 services that we proposed and received funding for. These 6 services represent those that are either not currently funded by Medicaid or are kind of insufficiently funded. So there is a way to potentially bill for them, but it wouldn't really be, the payment wouldn't be commensurate with the cost of the service. And so assuring that people can actually afford to offer the service means bringing in an appropriate rate and service definition and having all the formalities set up. And so the services that we're bringing in are partial hospitalization and intensive outpatient programs. These are services that provide that step down out of inpatient hospitalization so that folks, you know, may not need to stay overnight in the hospital anymore, but would benefit from somewhere to be all day during the day. So they might go all day in a partial hospitalization program for a while and sleep at home with their natural supports, and then move down to intensive outpatient where they're just going for the morning or just the afternoon and can start returning to work and school and other activities. So it's really about allowing for these step downs. Assertive community treatment is often referred to as a hospital without wheels. It's a very intensive treatment for people who are living with serious mental illness. And it's focused on bringing the team psychiatry, skill building support, therapy out into the community wherever that person is and really working with them in their natural environment, being ultimate problem solvers. And we currently have this through our ICT program, and there's a number of CSBs and a few private providers who offer assertive community treatment. And this is really establishing a tiered rate that supports the true fidelity to the model. So it's kind of an enhancement on an existing service. Multisystemic therapy and functional family therapy are two highly renowned, nationally recognized evidence-based programs for teenagers who are struggling largely with disruptive behavior, trauma, mood problems. These are two treatments that were used very effectively here in Virginia in the Department of Juvenile Justice's transformation. One of the things that I think is so amazing about these two treatments is that in other states, they've been shown to nearly eradicate the need for residential care for kids who participate in the service. And that's a pretty stunning statistic. So it shows that when kids are really surrounded in these intensive supports with their natural supports and in their natural environment, we can keep them from having to be removed and taken away, which is just never a great solution for anyone in the long term. We really want to try to keep kids with their natural support. That's where that strength really lies. And then I think one of the most exciting things that we're doing is a complete transformation of our crisis system, which I think is going to make a tremendous impact. I hope will make a tremendous impact for Virginians. And part of what is so powerful about this comprehensive crisis proposal is that it merges Step Virginia's efforts and the efforts within Medicaid. It really leverages the infrastructure of a statewide crisis hotline that we don't have right now, but would be developed through that process, and then brings in private and CSB providers together to offer mobile response to the dispatch that comes through that call center. Hopefully someday to be the 988 call center following the federal legislation, which we've needed for so long to have a mental health 911. This can avoid police involvement in response to mental health needs. And it really then allows folks to come in and go through a mobile triage to then either have a community stabilization support, so someone who kind of stays with the family until a referral to the available services is ready, maybe a couple weeks' time, or they can be brought to residential crisis stabilization, which we have right now, but we don't have a rate set equivalent for residential, or 23-hour beds, which are a place for people to be observed and to make sure they're okay, or to let the effects of any substances wane so that their real issue can be evaluated before they're admitted for like an inpatient stay. So this type of system has been implemented in other states like Arizona and Georgia, New Jersey, and they've done incredible work with really reducing hospitalization, keeping people in their communities, and reducing the trauma associated with the hospitalization process, with police transport, just all of the things that can go wrong there. So we're very, very excited about that comprehensive crisis opportunity. I'm not going to go through these slides because I just narrated them, but they will be available to you. So I will be brief. I'm aware of my time, but just to give you a sense of where we're at with this and how the advocates have really carried us through this process. We started this proposal about 2 years ago now, 2.5 years ago, really, with stakeholder implementation groups where we met with a large body of folks from across state agencies, advocacy groups, providers, really trying to understand, where we needed to start and how we needed to design this North Star and develop priorities. And once we developed these priorities of these 6 services, we broke out into stakeholder groups composed of providers. There were advocates there, peers, all kinds of folks were nominated into those groups, and they came together to really brainstorm and look at the service definitions we were proposing and bring up their initial concerns about how these services would look. That helped us to develop the rates with our actuary Mercer. Ended those rates a little bit over a year ago in a public meeting. At that time, we made it into the budget, into the governor's budget, and then we made it through the GA last year with everything intact, and we were ready to go. And then the coronavirus struck. And this proposal was one of those that became unallotted during the state of emergency. And through the special session over the summer, this was reallotted. into the budget. And so at that point,
I think we lost her.
I'm
Yes.
back.
Oh, good.
Can you see me now?
No. I mean, we
No.
can see you, but I
We-
think your camera might be off.
We can hear you, but not see you.
Yeah.
Oh no.
Mhm.
I think your camera's off. You sound like, your Wi-Fi is very strong.
There you go. We
And-
can see you now.
Can you
You
see
just
me
need
now?
to,
Share
yeah,
my
we
screen
can
again.
see you now. Yeah.
Welcome back.
Mhm.
I apologize. I do have,
Technology and Wi-Fi.
I know, I have 4 children here on this Wi-Fi doing pod school, so it can get a little testy. So essentially, we were on pause with coronavirus, and even today, we're still working to revise the budget because we've had to change our implementation plan because everything has gotten moved out. Like everything else in our lives, we've had to rearrange and think about how to respond following the onset of the public health emergency. So, Sarah, did you have something?
I don't think your PowerPoint is showing up, unfortunately.
It's not,
Oh,
no.
no. Well, I can narrate through it because I can see it. It looks like it's showing, but I don't know why it's not.
Okay.
Would you like me to talk my way through it? There's not too many left, so I think that I can paint it with my words.
Okay.
I would say stop sharing just so we'll see your pretty face.
Yeah.
Oh, it's back. It's
There we
back.
go.
But Alyssa, you're muted now. I'm sorry. We are so close to being perfect.
Okay, can you hear me? You can hear me now and you can see it. Okay. So the original budget looked like this, and it had a different phase of implementation than we are currently proposing. And this is just due to pragmatic factors. We've had to kind of alter that plan because the first year of funding was removed because that year is over. And so we're working with the second year. And there were a lot of questions when this came out. Does this still mean that all the services would be implemented? And it does. They're all still going to come in. It's just going to be on a staggered timeline. I'll talk about that in a moment. There were also some training funds to DBHDS that were meant to support this effort, and those were unfortunately unallotted and they did not come back into the budget. So those are on the line right now, and we're hoping that those will be reinstated through the General Assembly because those training funds are really critical to assuring that we're able to go full scale as intended with these treatments. So we're currently reanalyzing this budget for the second year rapidly to communicate with the powers that be because we have a revised version of our implementation where we would plan to go live with assertive community treatment, partial hospitalization, and intensive outpatient programs this July. That's a pretty quick sprint for us to get this together in the next 6 months. But we went with this angle because these actually would be the most straightforward in terms of systems changes and issues like that. It would be easiest for us to move these through quicker. Then we needed to push back multisystemic therapy and functional family therapy, just because we need to do some systems issues with those, as well as the comprehensive crisis services. These are going to be pushed off to December, and comprehensive crisis, as I mentioned, really needs to line up with the DBHDS implementation of crisis services. And we need time for that hotline to get started to make that whole service kind of seamlessly work together. So those will be a little bit delayed. And so after General Assembly is done this year, we will be reconvening all of our stakeholder work groups. We're also planning to add a racial equity work group and are currently taking nominations for that work group. If any folks today are interested in that, please, make yourself known to your advocacy organization. We're really eager to begin those discussions to think about how we can use data to drive racial equity through the delivery of these services. And we also have added a GA mandated MCO resolutions panel. This is a process by which the providers will be able to bring potential issues or concerns around contract compliance to DMAS to be reviewed, as I know that people are leery about.
Alyssa, we're using you again, losing you again. There we go. Okay, we've lost Alyssa again. Technology, our first ever virtual advocacy day. So we're learning some of the challenges that we might face using this venue. Hey, there you are. Okay.
My apologies.
That's okay. It's like I said, our first ever virtual advocacy day. We live and learn.
We live and we learn.
Yes.
So this is all to say that we are bringing everyone back together to the table. We've actually already started on a lot of this installation planning in terms of preparing for system changes, readying our regulations and manuals and state plan amendments. And we've been working on transparency with our data. So ways that we can make dashboards to put those public facing and show folks how these services are working and how they're being used. Our hope is that once our installation plan is clear and we've really gone live with these, we could make argument to CMS to apply for the 1115 SMI waiver, which I know many people in the community have been eager for us to do. This would open up adult residential services essentially in mental health like they were opened up in arts for substance use disorder. But CMS really wants to see that we have a robust evidence-based, community-based system before we would add in more high intensity institutions into our benefit, just to protect members from being kind of stuck in those institutional settings. So we're moving there. And even during the COVID times, we've continued on this effort. So even though we've been working heavily on pandemic response, we've held out the hope. We've held that candle for behavioral health enhancement by really keeping it as a priority for us. We've established an evidence-based practice center of excellence with VCU and a number of other state agencies. They're going to be helping us with evaluating and using implementation science to move this process forward. And we've, as I mentioned, taken on all this other work related to data and dashboards. And I already spoke a little bit about this waiver and what it would mean for us. And I spoke about the EBP Center. So these are all of the different work groups that we have, and not all of these have started up yet. We've been working on our phase 1 service work groups prior to the onset of COVID. We will reconvene those after the General Assembly. We plan on bringing together a quality measures work group, a workforce work group, founding this racial equity work group, and we have the MCO panel. So there's a lot of different opportunities for voice. And one of our concerns right now is figuring out how we can most effectively use member voice. How can we bring member voice into the table? We plan on doing a lot of public facing work as we get closer to implementation to help educate members about their options, using some new methods that Medicaid hasn't used before, like things like Facebook Live, and because we're going to have to be really creative in this virtual environment to reach people. We might have gone out and done town halls or been out in person in different communities, but we can't do that now. So we're going to try to do that virtually and over social media. But we would love, we're going to be working with our Medicaid advisory, member advisory panel to bring families and members into this process. So we welcome continued feedback about that as well. So that is the end of my presentation, but I'm happy to take questions. And this is our email address. So we always welcome any questions from anyone about this process at that address as well.
Thank you, Alyssa. That was great. you navigated the tech problems quite well. And we've had a really good conversation on the chat about just, how words matter, and that behavioral health is sort of, although I can see the point of it in some ways, it sort of implies a choice around mental health. And that doesn't help the stigma when people think people are choosing to be sick or to be behaving in a certain way. Are there any thoughts or conversations at DMAS? And I know it might be bigger than you guys. It probably has to go to DBHDS too, but about maybe reconsidering that word choice, or why that word choice continues to be used?
I'm trying to follow through in the chat. I think from my work in California, before I came back to Virginia a few years ago, there was a real emphasis actually from the advocacy groups. It's interesting because the conversation is kind of rippling differently in different places. And that terminology, I think, in so many spaces in this work is continuing to evolve, right? If we think about areas of gender, for example, we're really evolving and learning new ways to talk about the human experience of gender.
Mhm.
And I think in terms of the experience of, living and recovering from mental illness, there's also shifting ties and changes in terminology. So when I was in California, the advocates really pushed messaging around voice, choice, and access. So the idea that participating, and I always try to go towards using the word participating in care, not, that we're delivering care to someone. That's kind of traditional language. Like as a psychologist, I'm delivering, or or someone who's participating with me is just a recipient of care, but rather it's a relationship and it's a participation in that process together. So I see choice, but when I use it, I tend to think of it of, if you are participating in care, you should have choices about what that looks like to you and whether you participate at all. That you should have choice in what's the best fit for your family, who you want to participate, and what your goals are, what is going to bring meaning to your life. So I always think about choice in that way. But it's interesting. It's helpful to me to hear this kind of other perspective on that word choice.
I think the key word that was of conversation was behavioral health. And, about, I want to say 10 years ago, Virginia moved away from, Department of Mental Health to behavioral health and developmental services. And just this, like, what is the right word to describe mental illness in a way that is accurate and doesn't maybe lend itself to implying that it's a personal choice. So I don't know if you have any insights on that. I think that's sort of what I was taking away from what folks were saying.
I think behavioral health, my understanding of the evolution of that term nationally is that it's always been considered an umbrella term to encapsulate both mental health and substance use disorders. So traditionally, behavioral health is kind of like the larger category, and mental health and substance use disorders kind of fell underneath behavioral health disorders. I think that, it's an interesting intersection there of the idea of like choice and behavior. I think it's also meant to differentiate from physical health, but all these things are kind of problematic as Bruce mentioned, as we're trying to emphasize whole person health, and how physical health and emotional health or behavioral health are all completely tied together. They're inextricable. So, it's an important and interesting conversation about what is the best terminology to really, I think for me, the most important thing is an emphasis on what words do we use that are most empowering to people who are seeking recovery? What are words that are most respectful of their experience? And how do we move away from language that kind of implies victimhood, or that they're just controlled by a system, or that a system is making decisions for them. So how do we shift that? And I don't have the answers today, but these are good and interesting points.
Yeah, Alyssa, along those lines, just a comment in case others didn't see it. I think one of the other concerns is just the use of behaviorism and behavior management in the schools, because it really doesn't get at what we know about neuroscience, trauma, and stress response. So just something maybe to keep in mind, and certainly those in the chat who have more thoughts on this, make sure to take down that email address and you can connect with them just to give them any other thoughts. I have another question for you, Alyssa, and it relates to an estimate, if you can have it, of the new Medicaid payment rate for psych services. So just to give you some background, it's hard to find psychiatrists that take private insurance these days. Do you have any idea of what percentage of the private rate would be? Let's see, I suppose
for the
So
rate increase.
yes, would Medicaid be getting closer to the private rate?
Well, the private rate varies. It varies across insurer. They each kind of set their own, those commercial plans set their own rates. So it's hard to say exactly. I think that increase that was included in the budget is going to bring us closer, unquestionably, because it's going to raise it. But, I think that I could talk about this all day, but I think there's a bigger issue at hand as well that you kind of insinuated. Even if you have commercial insurance, it's hard to find a psychiatrist. That, in my view, we have a real problem nationally. This isn't just a Virginia problem, where a lot of LMHPs, particularly psychologists and psychiatrists, don't participate in the insurance game at all. It's a cash only business. And that kind of takes them out of the running. Many of them take pro bono, or have a few patients that they'll provide service for outside of their fee, but they're very, very expensive. And so it kind of becomes two separate systems: one for people who can pay cash, a lot of cash, for hourly outpatient care, and then people who can't. And that's unfortunate. And so, part of the goal of all of this is to try to make more attractive rates to pull more LMHPs back into participating in the system. But I think it's bigger than that. It's definitely bigger than that.
Excellent. Okay, I have one other question for you, which is, how does peer support and family support in the reimbursement rate, is that being included in this consideration? And if so, could you share a little bit more?
Yes, so we did have the participation of peers in many of these work groups. I know that Vocal was involved and nominated folks for many of the different work groups. And so some of these services traditionally include peers, some of them do not. And so we looked to create billing guidance, which we're currently working on, to explain, if the peer rate is included in the service, or whether peers would be billed outside of the service, because sometimes that's actually preferential. So they were involved, and that is the rate information that was preliminarily developed is on our website. There's a behavioral health enhancement part of the DMAS website where some of that is available. But I think that will become more clear as we continue presenting and coming out with the medical necessity on these services.
Great. One sort of follow-up question to the earlier one is related to psychiatrists. What do you think it will ever be possible at some point in the future where they might be required across the state to take a certain percentage of Medicaid patients, just to sort of make sure that there is providers in every community?
It's a great question. I don't know by what mechanism we could compel psychiatrists to take different insurance. So I don't know. I don't know what would compel them to do that, regulatory wise. But it does feel like the right thing to do. It does feel like something that people should want to do, but it's a complicated answer, right?
Right. Well, Alyssa, thank you so much for your time. If you could you just send me in the chat the email address you want folks to use? I've had a couple requests for it, and I'll just pass it along. and then we'll just pass it
Sure.
back to Kathy.
Yes, thank you, Alyssa. And I believe that individuals would like to have a copy of your slide deck as well, if we can share that. So thank you very much. Excellent presentation, and we appreciate your time. So thank you. And
Thank you so much for having me here.
You're welcome. Thank you for joining us. And for all advocates attending today, Alyssa's presentation really shows the diligence of your work we always knew it as redesign, it's called enhancement now. And so your efforts do pay off. The advocacy work that we do does pay off. And so you see where we are now with behavioral health enhancement. And I'm looking forward to seeing the different segments of this launched. Thank you. So now, Alexander McCauley is going to join us. Alexander has been a mental health advocate, a friend of mental health, a friend of NAMI, a friend of Mental Health America, Virginia for years. And he is going to talk to us a little bit today about the effect of COVID on our advocacy work and the General Assembly session. Alexander McCauley believes that a good advocate needs experience, expertise, and commitment. And I'm going to share my screen again now. So let me pull that up real quick. And let's see. Okay. And so Alexander's first legal job was at Mays and Valentine, which is a large Richmond firm where he litigated and lobbied. While there, he saw some of Virginia's best lawyers and lobbyists in action. After Mays, he worked with a series of outstanding partners, including Larry I'm not sure if I pronounced that right, Beverly Powell, Don Lee, and J.B. Birch. Today, Alexander is privileged to work with Hunter Jamerson, one of the best lawyer lobbyists in Virginia, and Lindsay Walton, a rising star in healthcare law. At McCauley and Jamerson, Alexander focuses on healthcare law and government relations. Alexander is a Richmond native and grew up hearing many lobbying and legal war stories from his father and grandfather. That led to volunteering in campaigns and a job as a page in the Virginia House of Delegates. Alexander then worked in the governor's office, House Clerk's office, and Department of Information and Technology. Alexander majored in history at Wesleyan University in Middletown, Connecticut, and graduated from law school at the University of Virginia. So please join me in welcoming Alexander.
Kathy, it's great to see everybody here today. And I wanted to thank Elisa for that presentation. It was fantastic. I would like today to talk a little bit about what's going on at the General Assembly. Kathy, I'm trying to get your screen share is still on. Make sure there we go. Thanks. And I've so enjoyed working with Bruce, and you know, there's just been such a great collaboration between Mental Health America and NAMI. I would say, well, for the last 5 or 6 years, and it's been great. So thank you, Bruce, for everything you do to make that collaboration work. And the other thing I want to say about my biography, some of those jobs sound very impressive, but in the clerk's office, I was in charge of distributing pencils and envelopes to the legislators' offices. And in the Department of Information Technology, they had these giant magnetic tapes where the Medical College of Virginia kept all of their patient records, and I was in charge of cleaning the outside of those magnetic tapes with rubbing alcohol. So it was a really exciting summer job. But since that time, I've been lobbying at the General Assembly, and my favorite of all my clients is NAMI. It has been the most personally and professionally rewarding work that I've ever been able to do. The energy and the commitment of each of you is amazing. It's humbling and it's inspiring, and I just love working with you and representing you. So thank you. The psychic benefits, or I can't even tell you how much I get out of working with you. So Kathy's kept me on a tight leash today, and so I'm not going to talk for too long. But I did want to, in terms of illustrating to you what's going on with the General Assembly and in terms of COVID, I wanted to share my screen here today of the schedule just for today at the General Assembly. And I'll try not to scroll too fast, but the biggest change is, of course, that the House of Delegates is all virtual. There are very few delegates in Richmond. All of them are participating from their home offices. And there are some budget legislators who are in town, but for the most part, everyone is back in their districts, and each meeting is a Zoom. It's really, really hard to lobby in this environment, and we are trying to text with legislators, trying to set up Zooms, and it's been hard. I hope this is the last time we ever do this, but they did in the House completely change their schedule to where the subcommittees start at 7 o'clock in the morning, followed by full committees, and then the floor session doesn't start until 4 p.m. So you can see here kind of what we contend with. You've got 5 meetings going on at once at 7 a.m. Then 2 meetings, and all of these are now rolling in together. So now you've got 2 meetings layered on top of that. So, and then these are still happening. These then start up, and on it goes. So it's been pretty insane, and I hope that we're getting our voice heard in an effective way, but it has been quite challenging. The other thing I wanted to show y'all, and just to back up a little bit, the Senate has stuck to its regular schedule. So here you see, they come in at the regular time, and for caucus, and then there are floor sessions, and they're in person. They're at the Science Museum. Some lobbyists are camped out in the Science Museum parking lot and trying to get with legislators as they come and go out of the building. But I have not been doing that. I just, given the age of many of the senators and their vulnerability to COVID, I just don't think it's a good position to put them in. So I've not been doing any in person with frankly, with any legislators. So then you see some more meetings, and then today, for instance, the House is convening at 2:30, which is a change, which shows that they are finishing up their work a little faster than they're accustomed to, and they did put in some very strict bill limits. Was 11 for senators and 7 for House members. So the overall bill counts are much lower than before, and that has helped some. The other thing I wanted to show y'all is the bills that NAMI is currently tracking, and we use this service inside of the Legislative Information System called Lobbyist in a Box. And this is a list of all the bills that we are currently tracking for NAMI. And one bill that I think might be of interest to people, this is it's a House Bill 1951. It abolishes the common law crime of suicide. It's never charged or used, but I think on a symbolic level, it's an important bill, and that has passed the House and is now going to the Senate. Another bill that we have put a fair amount of time in on, consistent with our work over the years on housing, is a bill of Senator Dunavant that I'm scrolling down to right here. And some of y'all, are familiar with a housing supplement that's available to persons who are on SSDI, on Social Security disability. And one of the things that NAMI worked very hard on for a long time was to make that housing grant available in a supportive housing setting. Prior to us getting that change, it was only available in the assisted living setting. And it's a clear violation of the Americans with Disabilities Act and the Olmstead Law, which mandates that persons should receive services in the least restrictive setting. And an assisted living facility is rarely a great setting for persons with a serious mental illness on SSDI. So we lobbied to get this new setting. Unfortunately, Senator Dunavant's bill has a rate increase, but it does not, that rate increase only applies to the, here you can see right here in line 48 and 49, the rate increase only applies to assisted living facilities. So we gave her an amendment to include supportive housing in there. And I thought she was going to get adopted, but it didn't get adopted in subcommittee yesterday, and it's still in subcommittee. We've been talking to Senator Hanger, who chairs that subcommittee, to try to get him to make the amendment, because this is clearly, in our opinion, a violation of Americans with Disabilities Act, because the state can't pay a higher rate to the most restrictive setting. We think that's illegal. And not to mention terrible policy, because it will end up with everybody being funneled into assisted living facilities, and it will cannibalize the supportive housing settings. So that's been a big one for us, and we'll continue to work on that. I want to go back to our bills to see if there's anything else that I wanted to highlight. One thing like talking about this auxiliary grant bill, it's a great example of how hard it is to lobby with the COVID restrictions. Before, prior to yesterday's subcommittee meeting, I could have circled back with Senator Dunavant and said, I emailed her our amendment. She said, got it, it'll be done. And then, ordinarily I would be able to talk to her right before the subcommittee. I would be able to talk to the subcommittee chair. I'd be able to talk to members of the subcommittee right before the subcommittee started. I could talk to staff. You got the amendment? You ready? Everybody's going to say aye when the amendment's going to get brought up. Can't do any of that. A few texts with her to try to get her to make the amendment, but it just, I wasn't able to get it done. So it's hard, and we're going to keep working on that and everything else that is coming up. Now, I did want to, on this same point, I wanted to call your attention to this bill of Senator Spruill, and this is a study of the auxiliary grant, and I think it will be a good opportunity, to get our point of view heard on the supportive housing setting. And I suspect that at the end of the day, they may not advance Senator Donovan's bill in order to allow this study to be done. So we'll see. So with that, I'm going to turn off screen sharing, and I'm happy to answer questions. Kathy told me to stop at noon and take 10 minutes of questions. So I'm ready to, you can fire away on any aspect of the General Assembly, and I'll try to answer. Or if there are any bills you want me to talk about in any more detail, we got 10 minutes.
Thank you, Alexander. I've got one for you. Just wondering what could be done to end the current unethical dilemma of treating people once again in crisis, basically getting them out of the system as quick as possible and not really doing a good transition process.
Yeah, thank you for that question. That's a fantastic question. And it's why we have tried and tried and tried to build that housing capacity, to build the permanent supportive housing capacity. I think the Northam administration has done a really good job on increasing funding for permanent supportive housing. We did, and I will say, with we have always supported more money for discharge assistance planning, and we're going to continue to beat the drum for that. In my view is that we have to build the housing capacity. Interestingly, an idea that a lot of the housing advocates are working on, including some NAMI members like Virginia Supportive Housing, is to dedicate some of the cannabis legalization tax revenue to permanent supportive housing and transitional housing. And so we'll see, those bills are being heard in subcommittee this afternoon, and that might be a nice source of dedicated revenue.
Great. I had one other comment that was sort of just to piggyback on what you were saying. It seems that the ARC of Virginia, their priority is to change the rate for staff who provide supportive services for individuals at home so that it is compatible to what is comparable to staff at a paid facility. There was a 30% difference, and people are not able to life at home because they can't find providers who will work with such a low reimbursement rate.
Yeah, I feel like I heard a discussion in one of the money committees about this issue, and I feel like there might be a bill out on it, or at least a budget amendment, but I don't know much. I don't know a whole lot about that issue.
Okay. I don't see any other questions so far, Alexander. But I know. Okay.
Yeah, let me ask you one and say a couple of things. We were originally supporting Senator Donovan's bill, Senate Bill 1185, but when we noticed the changes that Alexander mentioned, we changed our stance on that. And so just to give everyone the latest information, you should have already received it in an action alert. However, I just wanted to mention that. And I wanted to ask you, Alexander, you've mentioned some of the difficulties due to the way the session is set up. Do you see the impact of advocates being more or less effective, considering that we cannot see legislators in person due to the COVID during the 2021 session?
Yeah, thanks for bringing that up, Kathy. I should have, directed that more head on. I guess, yeah, sort of in my bubble, and I'm just thinking about how it's impacting me. Yeah, no, I think it's really impactful because, legislators like to, meet with their constituents and, and getting face to face with them. And they're so, they make a huge effort to make themselves available. And I see Alana Crennan, who is Delegate Sickles' chief of staff, is online, and a big part of her job is scheduling constituents and advocates to come in there and meet with the legislators. And you can't do that. And I think for some of our advocates too, the technology, some of our advocates may be in places where their broadband's not very good, they can't Zoom, and so where before they could come in as a group, like on our advocacy day, and the legislators could see, wow, there's a lot of people who go to the trouble of coming to Richmond to talk about funding for mental health. That's absent now. So I do think, and Alana will probably talk about this with far more coherence than me, but I do think that handwritten notes are good, and anything that sort of stands out is helpful in terms of reaching out to legislators. And another thing we used to always do, of the budget, the regional budget hearings, we would bring people in from that region to participate in the regional budget meetings, and those were virtual this year too. So it seems like the human aspect, which is our strength, has really been diminished.
Right. Thank you. Yes, I agree. And we did participate in the budget hearings this year. Numerous people advocating for mental health items in the budget. However, it was certainly different being in a virtual format. So because we are working the way that we are during this particular session, and everything is virtual, and that human interacting segment is not there, do you feel outside of speaking or testifying during a session or during a committee meeting, do you feel like email or phone call is the best way to reach out to our legislators? Which way do you think would be the best way to reach them and have the desired impact?
I mean, I'm hearing from a lot of people that it's hard to get through on a telephone, that they're getting busy signals or full voicemails. So email, again, I'll defer to Alana because she's on the front lines. I always told clients that if you do email, put in the subject line, "I am a constituent," because they get just blitzed with hundreds of email an hour, from outside the state, outside the district, and there's no. It's if you were to sit in one of their offices and just see the volume of emails in there, I don't know how they're able to pick out the important ones. And that's why I've always been a fan of a handwritten note that which is a pain in the neck, and you got to pay for a stamp and so forth, and it's not very fast. But I think it does stand out from the enormous number of emails in their inbox.
Okay, thanks. And I agree. And one final question. Because we're in a 30-day session, do you think we're going to have a 2021 special session?
I do. I think that there's if you look at the calendar, the budgets are supposed to come out on the 7th, and I think that's right. And then the session is technically supposed to end on the 10th. So there is no way that the budgets can pass their bodies of introduction, crossover, reject each other, request conferees meet. I mean, it's just not going to happen. So I feel like they'll add a couple of weeks there to finish the budget and any major bills that need to be handled. But Alana's far more in the know than I am, and so you can ask that question, and she'll tell you what she can tell you. I do. I will. My time is up. So before you introduce Alana, I just want to thank Delegate Sickles, her boss, for everything that he does for persons who and family members of persons with mental illness. It has always been a passion of Mark's. He has been really strong, in particular, on getting funding for permanent supportive housing. Whenever I talk to him on behalf of NAMI, he brings it up. And since he took over that health subcommittee, he has gotten increases in permanent supportive housing. And, we're up to 1,200 slots. The Deeds Commission says we need about 5,000 just to meet the crisis. But, Mark's been an integral part of getting us to 1,200. So that's a big accomplishment. And Alana is a huge part of that. She is, I say this as a compliment, she's a policy wonk, and so am I. So she really is, she's not a political person, she's a policy person. And I'm glad you all get to hear from her today.
Yes, I am too. Thank you so much, Alexander. We appreciate all you do and appreciate the excellent presentation and responses to our questions.
Thank you.
Thank you. Okay. Okay, so let me pull our PowerPoint back up, and then I'm going to, we'll be able to hear from Alana. So let's see here. Let me take a minute to bring this up. Let's see. Okay. Okay, can y'all see my screen? Is it up? Okay. So yes, now we're going to have a conversation with legislators or representatives from legislators' offices. And as Alexander mentioned, as Alexander mentioned, Delegate Sickles and his office, Alana works, is chief of staff there, have been just an adamant supporter of permanent supportive housing and has an understanding of those needs within the mental health community. And so because we're in a live General Assembly session right now, Delegate Sickles was not able to be with us in person. However, Alana, his chief of staff, is with us today, and Delegate Sickles did send us a video. And so I'm going to show this real quick. Here we go. All right. Okay, let's see. And so we reached out to several legislator offices to be with us and join us today. And we were told that we would have either, if they can't be here, a representative from their staff here with us. And Alana has jumped in with us, and we're glad to see you, Alana. Thank you for being here. And so we may have more legislators or legislative aides or chiefs of staff like Alana jump in. And if we do, then we'll be able to incorporate them into this part of today's Advocacy Day. So Alana, again, thank you so much for being here, and thank you so much for all that you're doing and Delegate Sickles is doing to advance mental health in Virginia. If you could maybe just start off as talking a little bit about what you and Delegate Sickles see as a priority for mental health in 2021. And yeah, there you go.
Hello, everyone. It's so good to see you all. Thank you so much for having me today. I know Alexander was giving me lots of praise and he's all too kind, but really it's all of you who come out and support us, write to us, email us, call us, so that we know that you're there. And we're always happy to hear from constituents and listen to constituents. I know in the chat, people were saying they had difficulty hearing the audio. So I'm just going to play the audio of the video real quick.
Oh, yes.
And then I can go ahead and answer your question. So let's see if this works better.
Hello, Virginia NAMI. I'm sorry I can't be with you at your event today. We're very busy and I'm busy working on many issues of concern to you. Virginia just simply must do a better job of getting mental health services uniformly available all over our Commonwealth. We've got several bills this year that are going to move the ball forward, and I look forward to working with you and your advocates as we have a successful 2021 session. So thanks again. Call us anytime when you have ideas on how we can do a better job. I appreciate your support and all you're doing for the citizens of our great Commonwealth. Thank you very much.
All right, so I hope everyone was able to hear that.
Hello, Virginia school counselors.
Whoops. There we go. Okay. So, so what are some of our priorities for this year? So obviously Delegate Sickles is chairman of the HHR, which stands for the Health and Human Resources Subcommittee in Appropriations. So that deals with all of the health care related funding in the Commonwealth. And then he's also the chair of the Health, Welfare and Institutions Committee, which deals with behavioral health, mental health, other types of health professions, and anything related in that vicinity area of focus. So specifically this year, we're focused on a few budget items, such as the waiver slots. We put in for 425 waivers, which would complete adults in priority 1. We've also put in some language amendments to ensure that virtual and telehealth services for community-based waivers are able to continue post-pandemic. And then finally, we're looking to have a study done that would work with the Department of Medicaid and Medical Assistance Services and the Department of Behavioral Health, and do a whole review of all the different waiver provider rates and methodologies to make sure that we are doing and providing an adequate network of providers.
Okay, good. Now, do you have you said that was put in as a budget amendment, or do you have a bill number?
Yeah, so I can give you some budget item numbers. So the first one that I talked about, that was the waiver slots. I can pull that up in 1 second to talk about that. But for the language regarding telehealth services, that's going to be item number 313, number like a #, 11H. And then the second item I talked about is going to be item 313, #, 12H. And then a final item that I didn't mention is that we are working with another language amendment to direct the Department of Education to submit a report on their implementation of early childhood mental health consultation and identify any barriers to service. So that way we can make sure that if we need to take any more legislative or regulatory action, we can do so. That's going to be item number 137, # 1H. And I'm going to pull up my internet and get you the number for the slots. It gets a little slow when I'm on a Zoom as well, so give me 1 moment. It's going to be item 313, number 29H.
Okay. All right. Okay, thank you for that, Alana. And thank you so much for being with us today. We know you're busy and we appreciate you peeling off a piece of your time to join us today. So what do you think? This is something because Advocacy Day, we have a lot of advocates joining us today. When advocates reach out to your office, what do they do that works? What is effective from an advocate in your opinion?
That's such a great question. I think I see that Colleen Grady from Delegate Willett's office is now in the room. So I want to invite her, if that's all right with you, to answer this question with me. I think having two different perspectives of staff members might be really helpful to answer this question. So Colleen, I'm going to toss it to you.
Yeah, sure. Can you all hear me all right?
Yes, welcome, Colleen. Thank you. I didn't see that you had joined us. Thank you for being here.
Oh, yes. Thank you so much. Sorry for a little technical difficulties on my end, but really happy to be here. I would say for me, one of the things that's most helpful is number one, make sure that you're emailing your delegate or your elected official because your voice is going to be, loudest and strongest when it's, speaking to the folks that are directly representing you. And then I would say if you can, make sure that you include a bill number. There's so many different pieces of legislation that can touch on a variety of issues, and we want to make sure that we best understand the issue that you're really speaking to. And then I would say, any way that you can personalize the letter to sort of give us your personal connection, why the bill or the budget item is really important to you is really helpful. We have a lot of conversations with a lot of different groups around policy, but something that can be lacking is personal stories that are related to the issue. So I found that those are really helpful. And yeah, I would say those are the major pieces. Alana, I don't know if I missed anything.
I would completely agree with you. I saw earlier people had asked what's the best method to communicate with us. And I know that normally, obviously, it's in person or by phone because we have our administrative assistants answering the phones all day long and getting messages to us pretty quickly. But this year, I think email has been the best way to communicate because we do have that delay of the phone going into our call center that we have this year. I saw someone ask about faxing things over, and I don't think faxing is an efficient way anymore because that would have to go directly to the office in the Pocahontas building, and none of us are really there right now because of the pandemic. So I just wanted to address the method to get in touch with offices. I think email is probably the best way to do so with all of the items that Colleen mentioned.
Could I jump in and ask Colleen and Alana a follow-up on that?
Definitely.
Okay, thanks. So just, when I was a legislative assistant, there was so little comment coming in, you could just kind of stick it in the delegates bill folder, prior to the committee vote. How do you just sort of, I guess, tabulate it and present it to them? Are you even able to do that? If it's some bill that, let's just take like your prescription drug transparency bill that y'all have, Alana. You're probably getting just blitzed. What do you do?
It's a great question. It's funny you mentioned that because it was just up for a hearing as I came over to this call. So what we do in our office is we go through the email and we have a system. We have our interns look through. We have a separate account that we forward things to, and I skim an email very quickly. And I identify if they've put their address in there and if they're a constituent. So that's why Colleen was saying it's really important that you put your address there, that you're a constituent of ours. And then from there, if they're a constituent, then we have exactly what you said. Our interns tabulate. They have an organized chart that has every bill number in it. And anytime something comes in, we take a tally of for and oppose. And then when his bills come up before going in to present, we let him know, how many people have written in opposition or in support of something, if we've been getting blasted, things like that. If there's stakeholders who want a meeting or request a meeting, we always try to at least get someone from our office to meet with them prior to the bill being heard. So those are just some of the strategies that we use.
I think that's really helpful.
Yes, thank you. Thank you. And Colleen, with this virtual platform, I didn't see your little photograph when you first came on. And so I want to let everyone know, Colleen Grady is from Delegate Willette's office. And thank you for being here. Sarah, do you see any questions in the chat from advocates joining us right now? I have a few more if you don't.
I don't have any questions, so Kathy, I'll turn it back over. But Alana, if somebody is interested in talking to you about expanding telehealth visits to the state hospitals, so I'm just going to pass him your email directly and turn it back over to Kathy.
Okay, thank you. Thank you. And Colleen, before you came on, Alana was speaking about what Delegate Sickles' office sees as mental health priorities in Virginia. What do you and your Delegate Willette's office see as mental health priorities for 2021 in Virginia?
Yeah, I caught a lot of the what Alana was saying, so I really want to echo her sentiments. I also kind of want to chat not so much as overall priorities, but a little bit about the legislation Delegate Willette is introducing related to mental health.
Yes.
We have one bill that's related to community service boards that clarifies some language and promotes community service boards to contract with private providers to be able to meet their STEP Virginia goals as a way to sort of really help meet the immediate need we have in lack of behavioral health care services. And then we also have a bill that we've been working on with DBHDS regarding, well, essentially they were doing an overhaul of their licensing and internal operating procedures, and realized that there was a little bit of a gap in some of their background check policies for workers in direct care positions that had been hired through a staffing agency or as contracted employers. So we have a bill that would require all independent contractors in direct care positions to undergo a background check, prior to working for DBHDS. And then I would say, as chair of behavioral health, we've seen a lot of really interesting things come before our subcommittee. We, had legislation from Delegate Coiner that established the standard that if someone enters a regional or local jail and receives a behavioral health screening, if they're in a crisis situation, they'll get an assessment 72 hours after that screening. And the bill also included, provisions to study potential impediments to making it so that everyone receives a mental health screening when they enter a local or regional jail within 72 hours. So I think a lot of what we have going on is making sure that we can, increase access to services for people most in need, and whether it's from our community service boards within our prisons and jails, and then also, I would say just doing what we can to try to improve access really to behavioral health care. I think one of the major issues folks have is not being able to get the care they need. So I'd say that's what we're really focused on.
Yes, thank you. And the bills that you mentioned are House Bill 1976, House Bill 2070, and House Bill 2092. And NAMI Virginia is supporting all three of those bills. And so thank you for that. And Alana, with the budget amendments, the item numbers were given, and thank you for that. And we plan to support those amendments as well, because we agree the additional funding is needed. Now, there may be some more questions coming. Oh, go ahead, Colleen. Yes.
Sorry, I didn't want to interrupt. Just wanted to let you know that Delegate Willette was able to join, and he'll probably be able to explain our bills and some of what we're doing much more eloquently than me. So I'm just going to toss it over to him.
Okay, wonderful. Thank you. Welcome, Delegate Willette.
Hi, it's great to be here.
Thank you. We're glad to have you.
Yes, and actually, no, you were speaking with the more knowledgeable person. That's Colleen. So I'll defer to all of her explanations for sure.
Okay. Okay. Yeah, she went over the legislation that y'all have introduced this session, and it sounds really good. And as I was saying, NAMI Virginia is fully supporting that legislation. So thank you for your efforts.
No, thank you. Thanks to everyone who's on today. I know it's not our first choice to be doing all these things virtually, but we are strongly encouraging our friends like NAMI to have these events, and we as members will get to as many as we can, and we really depend on these dialogues. It's so helpful to hear from you throughout the year, but certainly during session as well. Have you weigh in on the different bills. Obviously, the budget is important too, and really do value the dialogue. So let's we'll do it virtually as long as we have to, but I do look forward to getting back in person with you in the not too distant future.
Thank you. Thank you so much. And let me ask one more question for all of you. We were speaking about the importance of hearing from constituents, but sometimes advocates will reach out to members of different committees, whether it be appropriations or what have you, but they may not be a constituent of the legislators on that committee. How effective is that advocacy work?
I can certainly start with that response. I mean, every voice of every Virginian matters, and so we want to hear from everyone. I will say we do get an amazing number of emails and phone calls throughout the year, but particularly, of course, during session. And so, in terms of responding to those, yes, we do prioritize actual constituents in my case, from the 73rd district here in Central Western Henrico. As a committee member, so flipping to the committee posture, yeah, I mean, we are interested in hearing from everyone there, and I tend to actually take on a broader audience there, because as in the committee role, we really are supposed to be representing the whole state. Again, sometimes it's just not practical to respond to everyone, but we really do encourage that. And so I think the perfect alignment, of course, is when you have you need to communicate with a committee member, and you're doing that through a constituent. That's so the perfect alignment. If you can't do that, then yes, anyone who can speak to an interest in the bill, and particularly folks who have, as you do, members with life stories to share. That really makes a difference. We're all programmed to remember, be influenced by, and to remember stories, and so that's certainly what sticks with me, is when I hear from a constituent, good and bad, in terms of the experiences they've had and how we might be able to help that. So the stories are great, and yes, you can summarize things in writing. That's wonderful, and then as much as possible, get on a Zoom virtual meeting like this, and then testimony in the actual committee meetings. And I'm now a subcommittee chair, as you know, for behavioral health, and we get in every person we can off of that public speaking queue, to at least give them a few minutes to share their thoughts.
Yes, thank you so much. And as you can see on the slide here, Alana and Colleen, we knew for sure that they would be able to make it. We weren't sure which delegates or senators may be able to jump in or not because of the active session. And we are so glad, Delegate Willett, that you have been able to join us, because we know you are extremely busy. So the value you've placed on this event by taking a few minutes to join us means a great deal to us. And so thank you so much, and thank you for the legislation that you've introduced to further mental health in Virginia this session.
No, it's my pleasure. And again, absolutely, just reach out to me through my office. The Dale R. Willett email works great, and calls are welcome too. And let's keep the dialogue going. I really encourage it. I know, again, as I said, it's a challenging time in so many ways, and communications are certainly challenged and stretched. But I think we're leveraging the technology, and again, I know who you are and what you stand for, and it's just really important to keep this discussion going. Thank you so much.
Thank you. We agree. Thank you. And Colleen, Alana, thank you both for joining us today as well. We know the hard works that you do often behind the scenes, and we know that sometimes all the efforts that y'all put in are not recognized as keenly as they should be. But please understand that we value what you're doing, and we certainly do appreciate your support of mental health. So thank you so much.
Okay. Thanks, everyone.
Okay,
Bye.
okay, y'all have a wonderful day. Thank
Well.
you. All right. So, we reached out to numerous legislators and their offices for Advocacy Day, and we're certainly just honored that Alana and Colleen and Delegate Willette were able to join us. Senator Hanger and Mark Keem are certainly with us in spirit, but were not able to join us today. And so, but we do have a few other advocates legislators or their offices who will be with us. And if they could not, they submitted a video. And so Senator Deeds was unable to be with us in person today, but he wants us to know that he understands and that he is with us, even though it's not physically. And so he submitted this video, and I hope that you can hear it. I know Alana mentioned that some may not have been able to hear it previously. So I've turned the volume up on my computer. So it's as high as I can go here. And let me know, hopefully you'll be able to hear Senator Deeds.
Kathy, check and just make sure that in the video it's actually not muted. Like hover your mouse over the screen. There you go. Let's get that all the way up. Perfect.
All right. Yeah. Okay, I'm going to start it over.
All right, double check it one more time, Kathy. I'm sorry. All right, guys. Well, it doesn't seem like this is working, but I can post both of these messages, and Senator Deeds is really a wonderful one in our event page just now, so you can check it out there too.
Yeah, Sarah, do you want to try to share it? If I stop share or just post it? Okay, we'll just post it. I apologize. Again, this is our first virtual advocacy day, so any technology difficulties that we face today, we can address so that hopefully we'll have it perfected next time we need to host a virtual event. Well, thank you to Senator Deeds for sending a video. He understands the needs that we have for mental health in Virginia, and he is also doing a lot of work. And today, Tracy, the Senior Legislative Director from his office, is joining us, as well as Rodrigo from Delegate Tran's office. So we thank y'all both for being here. And Bruce, I'm going to let you pick up from here. I'm going to hand it over to you. There we go. And you're on mute, Bruce.
All right. Well, thank you, Kathy. And I see Rodrigo is here. Thank you, Rodrigo Velasquez, who's the Senior Legislative Aide to Delegate Kathy Tran. Would you like to say a few words about what you all see as priorities this year related to mental health?
Yeah, well, first off, thank you so much for putting this event together. I was able to hear the last few pieces of the last panel, and I will say it was so great to have Alana there. I always say she's my bestie at work because we work so closely together. As you know, her boss, Chairman Sickles, oversees our Health, Welfare, and Institutions Committee, and which my boss, Delegate Trans, serves on. And so we collaborate very closely on various issues and initiatives that come in that either deal directly with mental health or in one way or another overlap with mental health. I guess for my opening remarks, what I always focus on and tell people is one of the most important bills the General Assembly passes and works on is the budget bill. And at the end of the day, our budget is a reflection of our values, and what we invest in shows to Virginia and to everyone where our priorities are. And I think we've been very fortunate to be able to invest more in access to healthcare, including mental health care. I'm very hopeful that we'll continue to do so as we recover from the economic impacts of COVID-19. And we're thankful that Virginia hasn't been as hard hit economically as other states. I'm very hopeful that we'll be able to invest and make additional investments in improving access to mental health care. It's crucial. I think it's, goes without saying the impacts that COVID-19 have had on mental health of Virginians, as well as just our overall ability to, it's also just shown and spotlighted the inequities in access to healthcare. And that's something that we're very hopeful that we'll be able to work on. So I'm happy to, I'm looking forward to the conversation, and I see that I'm going to be joined by incredibly smart and competent panelists. So hopefully I'll be able to keep up.
Thank you. No, we appreciate that. And is Tracy in the room yet, Sarah? Okay.
Well, I don't see her, unfortunately.
We're expecting her, and I know that Delegate Hope had a whole lot going on. I'm not sure that he'll be able to join us, but we'll see. But in the meanwhile, we might have some questions in the chat. And I was going to ask you, Rodrigo, in terms of, you mentioned the budget, and to a lot of advocates and citizens, the budget is a big mystery. It's a little easier to get a hold of a bill because you can kind of look at what it does and follow it through. With the budget, it seems to be more difficult to access. Do you have any suggestions for how people can go and find out really what a particular budget amendment does, or how to learn about it?
Yep. I think this goes, I can share some examples of how we've worked with the budget with our constituents. In the past, a constituent would let us know, hey, I noticed that funding for this is no longer available, or I would like to see an increase in funding for this, or one way or another. Can you help me out? That's just a very general request that we get. And at times we would, be happy to talk through the issue. So just for example, I think we had a respite voucher program at one point that is no longer funded because I think we had relied on federal funds for that. Because we got that clarification that it was federal money, we put in a request to appropriate state money for this respite voucher program. And worked with our staff to be able to identify the proper language to put it in, and worked with our constituents to say, because you asked for this program to get funding from the state, we put in this budget amendment, which you can find here. And there's a website that people can go to view kind of the process of the budget. And I can put that in the chat for everyone to see. And you're right, Bruce, it's not exactly aligned with the legislative information system that we have in Virginia for legislation, because the budget, it's almost its own, it's technically one bill, but it's a huge subset of smaller individual requests that go through their own process in the legislature. They have to be heard by subcommittees, then be approved by the full committee, and then they're voted on budget day in each chamber respectively. So, what I would encourage everyone to do is, if you ever have just a general question or a general request about something regarding funding, to reach out to your member who represents you in the House of Delegates or the Senate and say, this is something I'm really interested in. Can you get me more information on whether it's just wanting to know how much we're funding a certain program or a certain initiative, or whether you feel strongly that a certain funding piece should be increased or decreased. I work with constituents year round, actually, because it's not just during the legislative session that we work on these requests to identify kind of what's going on and how we can increase it or decrease it or just make the appropriate changes. The way that they're voted on is also a little bit harder to track because it's, again, not on our legislative information systems. The way that it works is every member can say, I want XYZ number of requests. Sometimes they're language only, which are policy decisions, and they're not necessarily money decisions. And my boss has a couple of those in this year to request like things like workforce studies or reprioritizing some of our workforce initiatives that we have, or some of the things that we're working on right now. And we also have like a language access, language equity study that we're requesting. So you can do policy actually in the budget. Then you can also do funding requests, and we have a number this year to provide additional funding for the Department of Social Services, $7.5 million specifically. Now, what happens is all those different requests are then given to different subcommittees in House Appropriations, and each subcommittee will vote whether to approve them or not. And then they move on through the committee process. And then it kind of looks like a regular bill, essentially, but it just needs to kind of get through that hurdle first. So harder to track, yes, but legislative officers are readily available to help advocates and just anyone who's interested in anything regarding the budget to get questions answered.
Well, thank you. That's very helpful, because it really is, even those of us who have been doing this for a little while, I think get kind of bogged down in the weeds of those budget amendments. So that's helpful. And yet I understand that if there's a language in the budget that may conflict with language in a particular bill, that the budget language trumps, that it supersedes whatever is in the bill. Is that correct?
That is correct. Budget language does supersede things that we put in the code. And I think that's a reason, sometimes I'll just be, kind of frank, like sometimes it's a little bit easier to do something through the budget process because there already might be language in the budget regarding a specific issue that you just might want to make an amendment to, or you just feel strongly about it kind of going hand in hand with a specific funding request. If you have a bill, and this gets just kind of a little bit more complicated, but if you have a bill that you learn about that you didn't put in a budget amendment request, the bill could die because you didn't put in the appropriate funding request to go alongside the bill. So sometimes, staff works really hard, like on our, throughout the year when we have different bill requests, I also need to do the research and ask around to see if there is a money request that we need to put alongside it, because if you don't, then your bill can't pass. It gets a little complicated, and it was a little bit more stressful this year because our budget timeline changed, so we had to put in my things a little bit earlier than anticipated in the past. But we're moving forward, and it's a short session, it's a virtual session, but we are continuing the work.
Yeah, no, thank you. We really appreciate that, and we know I know Delegate Tran has introduced some things related to mental health that may have to do with like physical disabilities or other challenges that people have. Is there anything that comes to mind that you think we should know about that might interest people on the call?
I think different people, it's no secret that COVID-19 has created additional barriers to access to healthcare. One of the specific issues that we learned about from a constituent was that hospitals limited the designated person that could be with an individual, particularly if they had a mental or physical disability or a specific condition that wouldn't allow them to make their own medical decisions and would need a designated person to be with them during the duration of the hospital visit, COVID-19 related or not. And so actually less than an hour ago, Delegate Tran was able to get the bill passed unanimously through the subcommittee, and it's to ensure that hospitals have a policy in place to allow people to have a designated support person with them during the duration of their visit at said medical facility, so that those individuals, and what happened with a specific constituent was that she had to really fight to be there with her child, and at one point was forced to be there in the hospital room for 40 days, because if she would have left, there would have been no way for her to get back into the hospital and be able to make, the healthcare decisions that she needed to make for her son. And her son has a developmental disability that doesn't allow him to make those decisions on his own. And he's over the age of 18, so there's some complicating factors there that we want to make sure the hospitals take into account, so that everyone is able to access the quality healthcare that we hope they're able to from beginning to end of a hospital visit. So
Right.
there's that plus a couple other things. I always say, like, everything kind of like touches on language justice, so we have making sure that whoever you are, regardless of the language that you speak, we're moving forward to ensuring that state agencies translate and provide adequate translation on information. And that's another big healthcare gap that we've noticed this pandemic. So we have a study to begin that process now.
Oh, that really sounds interesting and very current. I mean, dealing with what we're seeing in terms of, we've been talking about the impact of the whole pandemic on what already is a very stressed system and stressed individuals. And then what we see is such an exacerbation of all of that due to the pandemic, and kind of these needs that were already there are even greater. So we appreciate what you all are doing in that area. And then we had talked earlier some about the specifics of what advocates can do to get their voice heard. I think you heard maybe some of those comments about whether to email or call, or how to get your message through, given that we're doing everything virtually. Do you have any other comments on that or suggestions for people?
Yeah, I mean, I come from the world of advocacy, actually. Before I worked in the role that I have, I was an advocate for access to reproductive health care with my boss, another organization, before I joined Delegate Tran's office. And one of the most important things I learned as an advocate, and even when I was just a student, was there are a lot of great resources available to constituents. There are official government resources, and I'm sure my colleagues shared in the previous panel how to track a bill, kind of going through LIS and that, and staff in legislative offices stand ready to assist answering kind of those technical questions. So never feel afraid to ask. What I also learned was that there are a lot of great advocacy groups, and I wish I knew this earlier, that could help kind of walk me through the process beginning to end of kind of where to really put in my efforts and my energy. Oftentimes really great organizations can really help guide the limited time people have, because not everyone can dedicate 24 hours a day to advocacy as much as we'd like to. So what I was able to learn is, how to budget my time and making time for like committee hearings if I wanted to testify, if I needed to speak to my legislature because they might be unsure of a specific issue, focusing my energies there, or if it meant I just needed to focus my energies on organizing my friends who might live in other districts and the members who might be also not kind of on board with a specific issue. So kind of seeing, if I was a college student when I first really started caring about social justice issues, and I realized instead of trying to do all three at the same time, I could, better focus my efforts in doing one of those three really well, because that would make a bigger impact at the time. So, it's things like that that I wish I knew earlier, and that organizations have strategies and visions and goals and kind of benchmarks that they can help guide people to, so that one doesn't feel that they're just kind of running around and speaking very loudly but not being heard, and that's one of the most important things I learned when I was a student.
Yeah, no, I appreciate that. And that kind of touches a nerve with a lot of us right now, because, life is full already, and there's enough sort of stressor and enough stress and pressure. And then you add the legislative session on top of that, and to try to find the time and the energy to spend the effort that you really want to spend, to try to make a difference. But sometimes it's, as you say, it's to kind of think through, okay, what can I do today? What is the one thing I can do that might help make a difference? Because I can't do it all. So I really appreciate you making that observation about how we kind of strategize and work together. And somebody says, I don't have time to go down to the Capitol, or I don't have time, or I don't have Zoom, or, what can I do? Well, maybe you can write a note, a written note to your delegate or senator, or maybe you can make that phone call or call your friend who does have time. So that's really helpful. And I guess I don't want to keep Tracy out if she's in the room, but I don't see that she's been able to get on with us. Is that correct, Sarah?
Yeah, she's having internet problems where she's working today, unfortunately. She was going to try to join by her phone, but I don't know if it worked.
Okay.
And that touches, I think that actually highlights another important thing when it comes to access to mental health care. My boss is a really big proponent of telehealth. And in order to access telehealth, we need to really close the broadband divide that exists in Virginia. There are areas that are just completely inaccessible and have very little internet access. And for people who, that also might mean that there's very little mental health professionals available to them physically and would want to seek the telehealth services available, might not be able to do so because of the broadband divide. That's one of the things Delegate Tran supported during the special session. We allocated millions of dollars more to start bridging that divide. There's more that can be done, obviously, but I think that it's just a testament to why multiple issues can kind of intersect in different ways, and why it's important to kind of build that broader coalition amongst advocates to say, what can we do to kind of really build a kind of collective push to kind of help the most vulnerable. And there's obviously a lot of gaps that exist in Virginia and across the country, and we're really hopeful that we're learning from this pandemic that the need to close those gaps is urgent and needs to happen as soon as possible.
Yes, no, thank you for for making that emphasis, because that really is so true, and really appreciate that. And I know that just wanted to point out, if people don't already know, that those who couldn't join us today, Delegate Hope and Senator Deeds are real leaders and experienced advocates themselves, as well as Delegate Tran for mental health related work. And do we have any other questions? Kathy, do you have any questions for?
I was going to
Keep
mention
him too long.
the technical difficulty we were having with the video was me. I was the technical, and so I think I've learned how to show it. If y'all would like, I can try to show Senator Deeds' video now. And I did want to mention that Delegate Tran's bill that Rodrigo was referring to is House Bill 2162, and to have someone with an individual with someone in a hospital, that person that they may want there with them. So just to mention that. So if you want, I can go ahead and try to fix my technical challenges here and see if I can show Senator Deeds' video. Do you want to do that now, or? Yeah,
That's probably good. But first, I want to thank Rodrigo very much for being here. Really.
And Rodrigo, you may see it in the chat.
Absolutely.
We have a lot of new advocates, and they really loved your budgeting my time suggestions. So thank you for sharing. It's definitely been appreciated.
Yes, of course. Well, thank you so much for having me. And I guess I'll just leave to whether you're been doing this for a really long time or you're new. Your voice is so important. That's probably the greatest lesson I learned when I started this. It's, every voice matters and all the issues that you care about. And, I hope you continue to make it heard, because the government only works as well as the people who continue to stay engaged. I tell people it's not just on election day, it's kind of every single day after and before where you can make a change in your community about an issue that you care about. So with that, I'll have to step back because we have another committee that's going to start soon. So I'll get to that. But our office stands ready and available to continue this conversation and be a resource. And if we don't represent you, we're always happy to connect you to who does, to be able to provide that assistance as well.
Great. Thank you so much. Really appreciate
Thank you. Okay, thanks. All right, so let me give this a whirl. Okay, Sarah said I would see something in this bottom corner, so I am going to try it. And I just don't see it. Oh, she told me I could call her, so give me just give me a minute.
All right. All right. I'm going to see if mine will do it for you guys.
Okay, Sarah, in the bottom left corner, there's a button.
Can you guys hear me okay?
We lost a lot of money over the last session, between last session and this session. For mental health, we made extraordinary gains last year.
Whoops.
Now we're going to try to get those back. We did some good work during the special session, but we're going to try to get those back to get back to where we were when we ended the session last March. That's the way this work is. It seems like every time you take a step forward, you take a step or half a step back. We're constantly playing catch up, but your advocacy is important. In politics, the squeaky wheel gets the grease. You be the squeaky wheel because there are a whole lot of people that can't advocate for themselves that are counting on you, and they're counting on me. And all of us have to recognize that we're in this together. We have to stay healthy, defeat this virus, but we can't lose our sight of the goal, and that's a commonwealth where people who are in trouble, people who are in need of care, are able to access it no matter where they live. We need a system of care that works for everybody. Thank you for being part of this process. Continue your advocacy and let me know how I can help. Thank you so much.
He's a wonderful advocate.
Yes, good job. I'm glad we were able to show that. And I apologize for my inability to get it done earlier. Again, I'm learning that I'm not as technology savvy as a lot of people. And so I'm glad you were able to hear that. And I won't re-show Delegate Sickle since we were able to hear that through Alana's phone. So anyway, but I'll practice this so next time I'll do a better job. All right, let's see here. All right, Sarah, let me try to change the screen. Okay, so we've heard from a number of delegates and Senator Deeds today, and they understand some of the challenges that we're facing with mental health, and they've submitted legislation and budget amendments to hopefully bring us to a better place. And so I wanted to mention today that they understand the importance of advocates, and it's important that we understand the value and importance of our work as well. We do create positive change. And we heard that through Alyssa's presentation this morning, speaking about behavioral health enhancement. When we were advocating for redesign, we have reached the point that we're at now. Without our voices, we may not be where we are. Who knows what would have happened? So the advocacy efforts that we put forth are extremely important. And we heard from the legislators and from Alexander McCauley that even from Alexander, we heard that even though we are in a virtual session and we're not able to speak with legislators face to face, we are making a difference. They do pay attention to our emails and our communications. We heard from the legislative aide, Colleen Grady from Chief of Staff, Alana from Delegate Willette. We've heard that the emails are read, they are paying attention to the information in those. And even if we are not a constituent reaching out about a specific issue for that legislator, when they serve on a committee, they serve on a committee statewide, whether it be health, welfare, and institutions, appropriations, the Senate Finance Committee, whatever committee that is, they are making decisions that will affect the entire state of Virginia. And so there is a lot of value in reaching out to them and advocating if we need more funding for mental health services, permanent supportive housing, if there's a bill being heard that we would like to see passed, or if there's a bad bill out there that we don't want to see passed. Alexander mentioned Senate Bill 1185 put forth by Senator Donovan. Again, NAMI Virginia was in full support of 1185 when it first was put out, until we got to reading between the lines and we realized that Senator Donovan was not going to submit that budget amendment. We're hoping, I'm sorry, that bill amendment. We're hoping she still will, but as of Alexander mentioned, as of earlier, it had not been done. And so if she does submit the amendment, then we will get back behind Senate Bill 1185. If not, we're not going to be able to support that bill. So advocacy is extremely important. And we want to call you all forth to action today. But before we do that, you received a packet of materials in advance that included a few things that will be extremely helpful to you in your advocacy efforts. And one of those things, one of the first things in the packet, and I may be able to bring up the packet. Let me see if I can. Let's see here.
If you can't, Kathy, I can share the link with them.
Okay, yes, that's wonderful, and I can bring it up. So in addition to today's agenda, which we've heard from some very good panelists and legislators, as well as the aides and staff that work in the legislator's office. So you received the agenda in your packet, and we know that when you reach out and begin doing your advocacy work, it's good to have a sample advocacy message. And so we've prepared this one for you. You can use it as is, cut and paste, fill out the delegate or senator's name, and of course, put your name at the bottom or sign it. You can cut and paste it. You can change it around to put new things in here that you feel are important based on policy priorities or talking points that Bruce will be going over with shortly. The things that we put in here have been discussed today. The DAP funding for discharge assistance planning, Governor Northam has requested a budget amendment to add another $205 million to that for fiscal year 22. There are a few other things that you'll see in here addressing permanent supportive housing. Bruce had mentioned not Bruce, but Alexander had mentioned the 1,200 units. According to the Virginia Housing Development Authority, we have 2,100 units. However, 1,200 of those units, from what I understand, are specifically set aside for serious mental illness. And so just so no one becomes confused on that, we are still in need And this sample advocacy message says that we need to provide the sample advocacy message shows that the Deed Commission study shows that we need 5,000 total units. And so even if you use the number of 2,100 in this message, we're still short 2,900 units. So this will provide you with some information there. There's also a budget amendment out right now requesting an additional 6.5 million for permanent supportive housing, which will provide another 500 units. And there's approval currently in the budget for 17 million for permanent supportive housing. So you can cut and paste this message, add your name and your legislator's name, or you can change it up based on the priorities and talking points that Bruce will be going over shortly. We've also provided a list of contact information for the money committees, which is the Senate Finance Committee in the Senate or Appropriations in the House. So if you would like to email all of these legislators with your message, then here is their contact information. And again, even though it was alluded to that you should reach out to your policymakers as a particular constituent, these committees focus on money matters for the entire state. So it is certainly okay to reach out to them as well. Okay, before Bruce goes over the talking points for the priorities, the budget and policy priorities this year, I'm going to scroll down a little bit further and go over a few more things that are in your packet. The advocacy reference sheet. This is just a little quick 10-point cheat sheet. We asked Alana and Colleen and Delegate Willette about the best ways to advocate. What do they like to see from advocates? And they gave us very, very good points on what they want to see. To be professional in our work, it's always courteous to introduce yourself. You want to be brief when you tell your story, especially in person, and keep it to 2 minutes or less. And so that's the reason you'll see the sample message is short, but it gets to the point, but it's professionally written. And some of these other points are when you are meeting with a legislator face to face, you want to try to avoid distractions. All advocacy work that you do, you need to always make an ask. That's extremely important at the end of whatever you do. You also should leave a fact sheet. And we sent you as a separate attachment to the email that you received with your packet, we sent you a mental health fact sheet for Virginia. So as you reach out to legislators here today after the session that we're having now, please attach a copy of that fact sheet to your emails. And then last, NAMI Smarts for Advocacy is a wonderful training that we offer. If you want to write your own advocacy message, then this is a 7-step process to do so effectively. Your introduction, talk a little bit about who you are. Colleen mentioned the importance of your story. So tell a little bit about what's happened in your life and what helped, and maybe a brief sentence or two about how you're different today. And then you want to just state flat out the need or the problem and what will help to solve that need or that problem. And then again, close with your ask. And there are some samples here. And this is a sample peer story, the same exact layout. And here is the information on those 7 steps in the NAMI Smarts for Advocacy layout, the samples that you just saw from a peer or a family member. So take a look at these, and that will give you a little bit of guidance and direction behind the structure of the 7 steps. And then we're also providing you with a story practice sheet. If you would like to have those 7 steps laid out with space to where you can write out your story on a practice sheet, you'll have this readily available to you for your use. And then common greetings with legislators are provided here. So in any written communications, email, letter, you need to make sure that you use these greetings that are laid out for you in this material. And then here's some information about how you can contact elected officials as well. And before Bruce jumps into priority, I want to mention that legislative info will be included on the Facebook event page. And let's see here. I think that was the only thing that I had not already spoken about. And I know I am speaking quickly because we only have 15 minutes before we close. And I want Bruce to have time to get to the talking points because they're very important in the advocacy work. And then hopefully we'll have a few minutes for any additional questions that you might have. So Bruce, I'm going to turn it over to you.
Kathy, can I jump in there real quick? Do you
Yes.
have a preference if folks BCC all the appropriations committee members in one email, or do you think it's better they send an individual email to each person?
I think it would be perfectly fine to BCC. So when you send an email, you have the CC line and the BCC line. If you use the BCC line, then no one can see which email addresses you've sent the message to. And so if you do use that, then send the message to yourself. So in the to line, you're just going to put your email address, and then you can cut and paste all of the House Appropriation or Senate Finance Committee members' email addresses from this material in this packet into BCC, and then you can send your message to all of them at one time. That way you don't have to do each one individually. So yes, please do that. But I would ask that you reach out to no less than 3 to 5 of the legislators that we've mentioned. And so, but yes, certainly the BCC field is very, very convenient, and I would strongly suggest it. Yes. Okay, thank you, Sarah. Bruce, I'm going to hand it over to you. And if you want to piggyback on what I just said, please do so.
Yeah, no, thank you, Kathy. And the sheets, the information that you just went over, just encourage everybody to make sure they read that. And then what's on the screen now are what I'm going to talk to, but I'm just going to talk to a couple of things because you have that information. And what we did was these are all budget amendments, and you heard Delegate Transaid earlier talk about how so much is done in the budget, and it's important if one of these items sticks out for you or something that you think you would really want to advocate for, be sure to include the item number when you are emailing about that. And Kathy went over the permanent supportive housing, which is certainly something that we all support. Another item under equitable access has to do with the number 2 here is what they call DAP funding, or discharge assistance planning funding, which helps support individuals in leaving the hospital. So you've seen the information about how crowded the state hospitals are and what a crisis we're facing with the delays in having beds available for people. But on any given day, there are perhaps 200 people in our state hospitals who have been clinically cleared for discharge. In other words, the people in the hospital say, you're okay to go, you're better, it's okay, but there's nowhere for them to go. So I think a lot of the supportive housing piece is creating places in the community that are healthy and supportive where people can live and get the support they need to stay out of the hospital. But there's a huge problem in that transition. So the discharge assistance planning it's included in the governor's budget amendment. So we want to support that $2.5 million to try to increase the funding to assist people in making that transition. Another one, you've heard of the Marcus Alert, or a lot of people have, in terms of that new way to respond to crises in a way that will help better protect people's safety. And the work group now is launched to help implement the new way to respond to crisis. but it is a huge undertaking because it involves so many stakeholders and so many groups across the state. There is an amendment to increase the funding to be sure that that's done right. And that's a $3 million amendment to the budget. Again, it's item 322, number 3S. Senator Boysko introduced that. The STEP Virginia funding, the big ask for that was approved in the earlier special session where the money was restored that Senator Deeds was talking about. So anything you can do to encourage people, thank you for restoring the money to STEP Virginia, which is the way we fund our public mental health system with all 40 community service boards across the state. That's our safety net, and it needs to be fully funded. The amendment proposed here is just a small one to try to be sure there's enough people at the state to ensure it works right. So, but the big push there is to thank them for supporting that. A couple of just smaller but very interesting ones. A pilot program a pilot program has been introduced, an amendment by Delegate Price for $200,000, which would support a program in Hampton Roads to pay peer specialists or QMHPs to accompany individuals in crisis who are waiting to be placed in an inpatient hospital. There are people in emergency rooms there's no bed in the hospital, so they end up waiting for sometimes a couple of days in the ER. Longer term solutions are needed for that. In the immediate term, under what conditions are they waiting? Who's with them? Is there anyone with them to look out for their interests? Someone who can relate as a peer to say, I've been there, it's okay, I can be here with you. To me, this is a wonderful pilot idea, and we would certainly support item 322, number 2H, Delegate Price, for $200,000 to try that out. Let's see how it works. And then finally, the behavioral health workforce. As you've heard, 41st in the state, we're 41st in the country in terms of access to a trained workforce. The couple of ideas out there, a loan repayment plan to encourage mental health professionals to move to Virginia and work in underserved areas. Senator Deeds and Delegate Carr have both introduced that. So it's in your packet, and it would really help address the problem of the severe workforce shortage. Another piece there related to the workforce is training the current workforce so that they are implementing all of that behavioral health redesign and enhancement that you heard Dr. Ward talk about earlier, to be sure that that's all implemented with fidelity, that it's done right. Because we don't want to have people come back later and go, we put all this money into these new services and they don't work, because we didn't fund them appropriately and train the staff to implement them with professional evidence-based practice. So that there is money included in the governor's budget amendments to do that, but we want to make sure that stays there. And then finally, there's only one state hospital for children and adolescents. That's the Commonwealth Center for Children and Adolescents in Stanton. They have a need for more professional psychiatric hospital staff so that they can give more one-to-one attention to children who are in critical stress. So there's an amendment to allow them to hire critical staff needed for that. So that just is a sampling. There are tons of others, and you all may know of other budget amendments yourselves. We're going to put more on our website. There's a lot. In other words, there's a lot to choose from. So we encourage you to move forward with that. So that's all. I know it was quick, but I just wanted to highlight a few items and encourage people to find something that connects with you, either personally or in theory or someone you know, and take action to encourage that amendment to be approved.
Yes, yes. Thank you, Bruce. And all of this information can be found on the NAMI Virginia or the Mental Health America Virginia websites. And so Sarah's going to talk in just a moment, but before she comes on to discuss the Facebook Live event, we would like all advocates, it's a call to action today. Legislators are expecting to hear from mental health advocates. They want to hear from mental health advocates. And so we ask you all to use the materials, use the emails that we provided, use whatever materials that you wish to use, the talking points, the sample message, to contact your legislators today. And so today is a call to action for mental health advocacy. You've heard several times today that we are in a short 30-day session. And so we do not have a lot of time, and the General Assembly is moving very, very rapidly this year. And sometimes it's even difficult to get an action alert out, because we'll hear about a meeting early in the morning that's happening a couple hours later, or we'll hear about it late the day before and it's happening at, you saw, 7 a.m. Some of this stuff is starting. And so we ask you all to please reach out to your legislators today, or the legislators on the money committees, and ask for what we need to support mental health in Virginia. And so with that, Bruce, if you have something to add, please do so. If not, I'm going to hand it over to Sarah so she can talk a little bit more about the Advocacy Day Facebook event that we have going on.
Kathy, I have a quick question from the audience. Can you clarify what exactly they should be sending their delegate or senator in the money committees? Should it be the talking points Bruce went over, or the sort of, I guess, stump speech you've made for them? Could you clarify?
Yes, they need to definitely send the fact sheet with all communications, and then the stump speech or the sample speech that has been prepared is one that you can use that addresses the discharge assistance planning, the permanent funding for discharge assistance planning, funding for permanent supportive housing. You can use what is in the stump speech. It's written to where you could send it off as is by just adding your delegate or senator's name with your name at the bottom, or you can change it up. If you see other things in the mental health priorities that are included in your packet that Bruce just discussed a moment ago, you can add some more things, or you can change what's in the current sample speech to the things that you feel like from the priorities are most important to you. What I will say is, if you throw everything in there that's on the priority list, again, it's going to be extremely long. You've heard from the legislators about the volume of emails that they receive. And so it is important to keep your message to a minimum. I would say no more than one more short paragraph to the sample speech. If you want to keep what's in the sample speech, but maybe you want to add one more thing from the legislative priorities, please do so. You can do that. You can also include the legislative priorities as an attachment to any email that you send. And so if you put the sample speech in the body, you could include a sentence at the bottom that says these are legislative priorities that I request you support, or that NAMI Virginia and Mental Health America Virginia are in support of. So I would include the legislative priorities either as an attachment with the sentence at the bottom of the body of the email speech, the sample speech, and also include the fact sheet. Again, you can change up what's in the body of the sample speech if you so choose. Bruce?
Yeah, I was just, yeah, I agree. I was just going to add it can get, there's a lot of information here, and we've kind of thrown a lot at you, but I would just encourage you, just choose one or two things that you feel more comfortable advocating for, and put, as you heard earlier, if it's a House bill, you put the number in the heading of the email, or if it's a budget amendment, put the budget amendment number and the title, and then indicate why it's important to you. Because we have to do it virtually, we kind of have to condense it more and maybe send separate contacts if need be on separate items. It sounds like that would be better. Try to keep it simple.
Yes, and you'll notice in the sample advocacy message that you can cut and paste into an email. The two key focuses in that are the discharge assistance planning, the permanent supportive housing, and the Marcus alert. So we were able to keep it short and simple, but focus on those three funding issues. And but if you want to change it up and focus on 2 or 3 other things, then you can just take out the Marcus alert or the permanent supportive housing or the DAP funding and put in what you so choose, but keep it short. Yes.
There's so much need out there. You can't do anything wrong with this,
Yes.
It's all needed.
Okay.
I really want to thank everybody for hanging in there with this today and being patient with us in the process. It's encouraging to see people willing to step up and speak out for this important issue.
Yes, ditto. Well said, Bruce. Okay, Sarah, discussion of the Facebook Advocacy Day event.
Will you switch it to the next slide real quick, Kathy?
Yes, sorry about that.
No worries. It just sort of spells it out, but we have a Facebook event page set up, which is sort of a place you can funnel questions you might have, look for information if you need it. We would love for you guys to invite other people to find the Facebook page to learn more, see the recording of this rally, and take action today. If you do take action today, we'd love to reward you. So please take a minute to just let us know in the comments of the post and the Facebook event, and we will enter you to win a raffle, to win a prize. And that's really it. We just wanted you guys to have a place to ask questions, continue to develop your skills as an advocate. I know we have a lot of seasoned folks here, but also a lot of new folks, and we appreciate all of you. So thanks again for your time.
Yes, okay, thank you. And last but not least, all of the materials that we've gone over today can be found on the Mental Health America Virginia or the NAMI Virginia website. In addition to what we've discussed today, you can also find the 2021 bill charts for our organizations, as well as advocacy tools outside of what we've shared during this session. And there are numerous other materials. So if you get a chance, please go to the websites and check our advocacy pages out and research what's there and available to you. And again, thank you so much for joining us today. Please reach out to your legislators today. And